Endoscopic spine surgery is a minimal invasive keyhole operation which apply to majority of the spinal condition. Is most common for disc prolapse or disc herniation, where patient usually presented with back pain and sciatica. It can also be done in the people who had a condition we call spinal canal stenosis, where you decompress the spine and improve the diameter of spinal canal and to relieve the symptom in legs and to prevent them for a future cardiac vena or blood and bowel symptoms. Endoscopic keyhole surgery is also performed in a cervical condition where patient has a cervical disc prolapse and arm pain. Uh, so this can also be done with the keyhole endoscopic discectomy. In addition to that keyhole endoscopic discectomy, we performed a spinal fusion, which can be done endoscopically. And similarly, even the tumor cases like malignant cord compression, that can be also be decompressed endoscopically and can be fused with a minimal invasive endoscopic assisted robotic approach. With traditional spine surgery, you open the spine, which you remove a lot of bones, you cause trauma or damage to the muscle due to exposure, and it increase it makes the rehabilitation, it takes longer for the rehabilitation process. And with keyhole endoscopic spine, the incision is very minimal, and patient, most of the time this is done as a day case procedure. Patients are discharged on the same day, and there is very minimal blood loss. And obviously, when you don't cause a collateral damage to the muscles, the rehabilitation is quicker, the pain is less in the post-operative period, and patient can go back to work very quickly. I think there are several benefits. Most important is that it's a very small incision. Number two, it's a less damage to the muscles and bones. Number three, there's a less chance of destabilizing the spine with keyhole procedure. Number four, there is a less blood loss. Number five, it's very safe and can be done as a day case. Number six, is done most of the time as a daycare procedure. Number seven, you don't need any post-operative great amount of analgesia. And number eight, cosmetically, it's also very acceptable. There's only small scar of about 7 millimeter. So I think these are all the advantage of keyhole endoscopic surgery over the traditional open operations. With endoscopic spine surgery, if we compare to the open spine surgery, there are only very few risks because it is operation is more faster, so the less chance of infection. Scar is also very small, about 7 millimeter, so chances of developing any wound infection is less likely. And because this is done through a camera and a keyhole, the chances of causing a spinal fluid leak is also very minimal. And most importantly, where we open the spinal canal, there's always a risk of causing a post-operative blood clot. That's why we observe the patient for 24 hours. While with the keyhole surgery, there's almost a negligible chance of having a blood clot in the operative field post-operatively. I have done more than 2,000 cases now, and thanks God, I haven't seen even a single post-operative blood clot in any of my patients. Yeah, physical therapy is generally required when the patient had a bigger operation where you open the spine and cut the muscles, especially when we are doing the open surgery, we cause injury or damage to multifidus muscle, and those period need a long period of physical therapy to recover fully. With keyhole endoscopic discectomy, you need a physical therapy, but that's only for a very short period of time as compared to the open operation.